The route of drug administration refers to how the medicine will be delivered to the body, and selection of a route of administration depends on some factors, and these include the consciousness of the patient. For example, you cannot administer medicine by mouth if the patient is unconscious. The dosage form available in the market is also another factor. There are different dosage forms available, including tablets, capsules, syrups, and injections. Your physician will only be able to administer what is available. We also have the speed of drug release and absorption. For example, in an emergency situation, such as an asthmatic attack, an inhaler is more desirable as it will deliver medication to the respiratory system faster compared to tablets. First, I'm going to talk about the parenteral route. The name parenteral is obtained from two words with Greek origin. Para means outside and enteron means the digestive system. So, it's basically outside the digestive system. The parenteral route involves injection or infusion by means of a catheter or a needle inserted into the body. There are different forms of parenteral administration, and they include the intravenous route, and in this the needle is inserted directly into the vein and the drug may be given as an infusion or as a single dose. It has 100% bioavailability and rapid onset of action. It's commonly used for inducing anesthesia, for chemotherapeutic agents, anticonvulsants, and irritant drugs. We also have the intramuscular route, and in this, the medication is injected directly into the muscle. This includes the deltoid muscle, which is the upper arm, the dorsocervical and ventrogluteal muscles, which are on the buttock. The thing is that these muscles have proper blood circulation that ensures the injected drug quickly reaches the systemic circulation. It's mainly used for hormonal agents, biological agents, antibiotics, vaccines, and analgesics. We also have the intradermal route, and in this, the drug is injected within the skin layers, in the dermis to be specific. It is mainly used to check for sensitivity and allergies to drugs such as penicillin allergy. It is also used in diagnosis such as the tuberculin test for TB diagnosis. We also have the subcutaneous route, and in this the drug is injected at the cutis, which is a layer of the skin just below the epidermis and the dermis. This tissue has limited blood supply, therefore medication will be absorbed slower and for a longer period. For example, the hormonal implants are administered through the subcutaneous route. We also have the intraosseous route, and this is only recommended for circulatory access in cardiac arrest in infants and children. It involves injecting directly into the bone marrow. The intraarterial route involves the drug being directly injected into the artery, and it's rarely used as it is considered dangerous. Its use is reserved for experts only. The intrathecal route involves injection into the spinal cord and is commonly used in administration of chemotherapy drugs or in pain management. We also have the intracavernosus route, and this involves injection of medication into the corpus cavernosum. It's mainly used in the treatment of erectile dysfunction. The intraarticular route is another form of parenteral administration, and this involves injection into a joint. This allows for localized drug action. Antibiotics and steroids are usually administered via this method in arthritis. Well, those were the parenteral forms of administration. Now we are going to be talking about the enteral route of administration. And remember, we said enteral means digestive system. So under the enteral route, we have the oral route, and in this the drug can be swallowed whole or placed in the mouth. For those that are placed in the mouth, we have the buccal route, and the drug is placed between the gums and the inner lining of the cheek, which is known as the buccal pouch. We also have the sublingual route, where the drug is placed under the tongue. This is the most cost-effective, convenient, and commonly used method of drug administration. Okay. We also have the rectal route, and this applies for suppositories and enemas that are used to deliver drugs to the rectum. For example, the use of glycerin suppositories is needed in cases of constipation. The topical route involves applying the drug directly on the surface of the skin or the mucous membranes of the eyes, the nose, the ears, and even the vagina. It allows for localized drug effect. Inhalation is another route, and this is used to rapidly deliver drugs into the pulmonary circulation. It's mostly used in inhalers and nebulizers for asthmatics and chronic obstructive pulmonary disease patients.